what I call passive progressive, I say flexion, but passive progressive movement. It's usually flexion based, and when it comes to pain or that injury, right? Like the are you injured or are you hurt? Why are you always pain, fear avoidance, okay? You need to go passive progressive movement to begin to gain the range of motion during those periods of having reduced pain, to begin to allow your body to know that new neuron firing, that new neuronal pattern. If you're in there and you're saying like, well, no, but I'm the exception, my doctor said I'm special, boy, you got to be some kind of outlier. You got to be some kind of outlier to be that special. And yeah, in an acute situation, and why I always go back to rule number 1, don't get hurt. In an acute situation, yeah, we're all exceptions. When you dive under that bar and that disc blows up, when you throw that baseball and your back blows out, into everything I just said in the last 10 minutes, and you understand where I'm coming from, that's what it's going to take for you to get right. That's what it's going to take for you to live the life you want to live. All right, well, here we go. Let's see how far we get. Good morning, everybody. I plan on making this an actual official podcast. Honestly, we'll skip right through all the small talk and get right to it. I mean, where have I been? Why have I not been able to make as much content that I feel is really informative, educational, value-driven? And quite simply, I got every excuse under the Tuscan sun, and I'm just going to lay it on thick. It is post second dose of the vaccine. So that means that my second dose of the Pfizer shot really didn't go well for me. Anyone in my close circle knows it. It's not just, an excuse. It's a real thing. It happened. Took away the run streak, left me feeling really ill. Was not able to wake up early for several weeks, even months, if you really want to get down to the nitty gritty. Recently got some blood work and it came back all perfect. Not just like clean, but every marker you could think of in terms of a CBC, things that we look for in terms of markers as to what may or may not be involved in cardio function or other types of inflammation were completely clean. And what's interesting is I do feel like I am over it, and I don't mean over it like, oh no, maybe 5-6 days from now I'll be tired again. I've successfully been up at 5 a.m. for the last 5 days now, and I feel like I am finally myself, which means little bouts of back pain here and there, and other than that, no real setbacks or compromised immune system type of scares. Leave us a review on Apple Podcasts. That would do us great justice here. I think you should leave us a comment, a like, and a share on YouTube. And maybe even if this makes it to IGTV. So here we go. So let's get into it now. What is an injury? And, how come you can't, seem to get right? Or let's just say you think you've tried everything. Maybe you haven't tried anything. At this point, it's like, oh, I have this injury. Oh my God, it's limiting. Am I going to get better? Oh, I'm the worst. My doctor said I'm the worst they've ever seen. Every doctor, doctors kind of have this problem. I don't really have this problem because I think there's a certain amount of lack of integrity that goes into the statement, which is, and I'm not saying, that I have a lack of integrity by saying it. I'm just saying it's true that, the doctor said I had the worst case I've ever seen. The doctor said my surgery was the hardest he'd ever seen. My spine was the worst they'd ever seen. My leg was the worst I've ever seen. A lot of us have been to doctors and have heard this be said that it's like, the worst case they've ever seen. There's a lot to unpack about why that is said, about why it's dangerous to say, in my opinion, why it shouldn't be said. But I understand that people need to kind of make you feel special, really. I mean, in the most simple terms, trial of care or the therapy or the medication they gave you, or the intervention or the surgery performed needs to be justifiable, needs to be quantified. They need to feel good about it too. But the thing that makes it an injury is something that is really, known as this fear avoidance, or like avoidance of certain movements, or being fearful of doing certain movements. That is what makes it an injury. That's the difference when it comes to hearing things like, are you injured or are you hurt? Well, if you're hurt, that means you can play. If you're injured, that means you can't. I'm quoting the 1995 or 6 movie, The Program, James Caan's famous line to Omar Epps. So the way that I like to think about it is, there are steps as to like how you get better. And the thing that kind of people miss in all realms of medicine, because everybody's their expert in their field, and the ones that kind of really have it figured out, is you've got to do something to get past what is the tissue deformation of the actual injury. So if it's a bulging or herniated disc, you need to do something to correct that tissue deformation, meaning the calcification and the inflammation and the bone degradation and the cartilage damage that's around that joint or that tissue, depending on where it is. Usually if it's in your neck or your back, there's, obviously a disc level that's involved in the spine, and, it may affect, or probably does affect, your extremity if it's chronic enough, or if it's been left alone for a long time. And then all of a sudden you start having like this extremity a problem, your arm or your leg per se, as an example. So here's the thing. You've got to correct this tissue deformation. That's where the chiropractic adjustment is so powerful and almost, imperative and vital. That's where things like massage and cupping, tapping, acupuncture to some extent, but these types of therapies really have to come in to begin to kind of, I don't want to say break up scar tissue, because you can dispute the evidence or the efficacy around statements like breaking up scar tissue or adhesions, but there's definitely some truth to it, and there's definitely some models that just in principles in biomechanics and anatomy and physiology that just make a lot of sense. The second part of it is understanding that you're not like retraining muscle or doing anything with muscle memory. And to quote Andrew Huberman, I believe it's neuron or neuronal, memory. There's actually, neurons that, have these, patterns, like these firing patterns, if you will, which create the biomechanics of the way in which we move. And if we become avoidant or fearful of moving in a certain direction because we associate that with our injury, that is a psychological barrier that we have to overcome. But how do we overcome that? Easier said than done, but I'll give you what I know works. As an example, chiropractic adjustment, as I've said, through what they call nociception, the nociceptive fibers, the pain inhibiting fibers that communicate with the brain, when you get a good enough movement in that joint biomechanically correct, you inhibit enough pain and increase range of motion. Thus, the job is done, as they would say. The job is done in chiropractic. That's partially true. But here's the thing. You as the patient, you're the only one that feels where that end range is. You're the only one that feels what that fear avoidance is like. Now you need to find the therapist that can match that, whether it's a chiropractor, a physical therapist, a massage therapist, a trainer, a guru, a whatever, could be your mom, could be your dad, could be a guy you found on YouTube, whatever it is. And then they take you through what I call passive, progressive, I say flexion, but passive, progressive movement. It's usually flexion based, and when it comes to pain or that injury, right? Like the are you injured or are you hurt? Why are you always pain, fear avoidance, okay? You need to go passive, progressive movement to begin to gain the range of motion during those periods of having reduced pain, to begin to allow your body to know that new neuron firing, that new neuronal pattern that says this is appropriate, this is okay, I can do it without being hurt. And then you have to find something that might be referred to as like a rate pressure product or a rate or something that kind of almost ties into the principle of diminishing returns. This is a little bit different. It might not be the right thing to say, but what I'm trying to articulate is, you might not be able to hold that pose for 30 seconds. You might be able to hold it for 10 seconds, maybe less, maybe 8 seconds in the beginning. And again, that's why I use the word progressive. It's progressive movement. It's not just functional movement, because you could use these functional movement patterns and fail at them again and again. It's progression in those movements, which starts off so minimal, and then passing those thresholds of avoidance to be able to achieve them. That is possible through the right kind of coaching, through the right kind of therapy. And that's what I want people to get in their head. Everybody's different, and everybody has their thing that kind of gets them there or says, this is what got me better. For me, it was chiropractic. It was, bone cracking, cavitating, bone moving, satisfying adjustment, chiropractic from a young age. Well, it wasn't really that young, but 25, up until I, had that, therapy for, 5-6 years, all the way through college, up until through chiropractic school as a patient before I became a chiropractor. And that gave me the gateway. But it wasn't really until the last year, and I got to thank, big shout out to Damon Patterson, Raw Power team, Raw Power Fitness. Sorry if I'm butchering that, Damon, but you're my guy. I go to you, and you taught me so much about this like applied kinesiology concept of reactivating and proprioceptive resets, along with this passive therapy that you use for me in flexion. And I said, holy shit, this is how I'm going to get, not just myself better, but I can apply this in practice to some of my patients. Does it work for all of them? No. Does it work for most of them? Yes. Why won't it work for some of those others? Well, one is maybe I misdiagnosed the problem in the first place. Maybe I didn't get the adjustment good enough on them for them to be able to get to the point of passive or just progressive movement, we'll say right now. And other people, it's simply because, yes, that's where the accountability comes in. You can't give up. It takes time. Training new neurons, training new pathways takes time. It takes commitment that people aren't ready for. And a lot of people don't understand the commitment, but doctors too, doctors and therapists too. You don't understand the commitment. The question is everybody happy in this like business model where it's like, fee for service? Are you getting paid enough? Are you charging enough? Are your patients willing to give you enough time, money, effort to get to the point where you are now no longer injured? That pain avoidance, that scared in, movement patterns, that actually is the reason that you have an injury, to be gone. That's the goal. That's the secret sauce, everybody. So if you're in there and you're saying like, well, no, but I'm the exception. My doctor said I'm special. Boy, you got to be some kind of outlier. You got to be some kind of outlier to be that special. And yeah, in an acute situation, and why I always go back to rule number 1, don't get hurt. In an acute situation, yeah, we're all exceptions. When you dive under that bar and that disc blows up, when you throw that baseball and your back blows out, when you, trip or somebody lands on your foot wrong in the basketball or the baseball game or whatever, sliding into first, and your knee just absolutely snaps in half, you are the exception. You are injured, and you have a choice to make in that tight window. Am I bad enough that surgical intervention or a very long road to rehab is about to happen? Yeah. So that's a whole other topic of conversation. But let's just assume that you're chronically hurt, but you're injured and you're functioning. And when I mean functioning, like you're going to work, but you're in pain every day. That's full circle of everything we just talked about. And that's where the secret sauce comes in. And that's where I just told you that progressive movement. Understanding, if you listen to everything I just said in the last 10 minutes and you understand where I'm coming from, that's what it's going to take for you to get right. That's what it's going to take for you to live the life you want to live. That's what it's going to take for you to run every day, to bike every day, to jog every day, to do CrossFit, to play basketball, to play with your kids pain-free, to play with your dog, to pick up your dog, to pick up your kids, to get in and out of the car, to get up and down from the toilet. Okay, guys? Got to take this call. Dr. Pearlman.